Hi, I'm Dr. Usha Kiran. I'm a consultant obstetrician and gynecologist. Today I will be speaking to you about the surgery you will be having. Laparoscopic hysterectomy. Laparoscopy means keyhole surgery. Hysterectomy is the removal of the uterus or womb. In a hysterectomy, which is a major surgery, the uterus or the womb is detached from the ovaries, from the cervix and the vagina and the side of your abdomen and taken out. You will not be able to have periods anymore at all. Menstrual cycles will completely stop and you will not be able to have any more children, but your sexual function will remain intact. When you're having a hysterectomy, you have a choice between having your ovaries removed or not. Of course, the choice is not completely yours. Your doctor needs to discuss and find out which is best for you. To know more about whether to have your ovaries removed or not, watch my video titled "To Remove Your Ovaries or Not." And also during a hysterectomy, you can have either a subtotal hysterectomy, which is keeping your cervix intact, that's the neck of the womb, and only removing the body of the uterus, or you can have the whole uterus removed. Again, the choice might not be yours completely, but to know more about the advantages and disadvantages of keeping your cervix, kindly watch my video titled "To Remove Your Cervix or Not." Laparoscopic hysterectomy is a major surgery, and before the surgery, like any other surgery, you need to have a pre-anesthetic check and blood test done. This is basically to see whether you can undergo a surgery or not. On the day of the surgery, you will be asked to come 3 hours prior to the surgery to the ward for admission, and also you will be told not to eat or drink anything including water for 8 hours prior to the surgery. This is to prevent any complication during the anesthesia. Your surgery itself will be done under general anesthesia, which means you will be put to sleep, so you will not have any pain whatsoever during the surgery. Following the surgery, you will be in the ward. You will have an IV line, which is the intravenous line, where they'll give you fluids because you will not be eating and drinking anything for the next 6 to 8 hours. You will also have a catheter coming out of your bladder, which is put prior to the surgery, which will stay in there for 12 to 24 hours so that it's easy for you to pass the urine through the tube, as you will not be moving around. So you might also have a tube coming out of one of the wounds, which helps to drain any excess blood loss which is there inside your tummy. After about 6 to 8 hours, you will be allowed to eat and drink gradually, depending upon how you tolerate it. About 12 to 24 hours later, your catheter will be removed and your drain will be removed. Of course, there is a variation in practice. It all depends upon how well you're recovering, how your pain threshold is, how you're mobilizing, and various other factors. After 2 days, when you're feeling fit and fine and mostly pain-free, you'll be allowed to go home. You'll be given antibiotics and painkillers to take home, and I will see you back after a week in the clinic. At that time, I will check your wound dressing, and I will also give you the histopathology report of the specimen that we sent for testing. After week 2, at the end of week 2, I will see you again back to check on your wounds to make sure, and then again you will have a visit at around 4 weeks as a final check to make sure everything is fine. When you get home after 48 hours from the hospital, after the surgery, you are expected to feel some pain, which should get better and better every day. It should not get worse. Usually people require painkillers only for about a week, not more than that. But if you do require once in a while, you can take a painkiller even afterwards. One of the common complaints that the patients have after the surgery is the feeling of bloating after the surgery, which is quite normal. It takes a while. Some people might find that it goes on for about a week or 2. Some people might just recover within 48 hours and not feel any bloating at all. If you do feel bloating, nothing to worry about it. As long as you're mobilizing, your pain is not too much, you're not bleeding too much, you should be fine, it'll get better. Your bowels sometimes can take a little longer to move. Sexual intercourse, traveling, and regular exercise can be resumed 4 to 6 weeks later, gradually, and of course with caution. I always say to patients, listen to your body. So do whatever is comfortable and don't do anything that makes you uncomfortable. Lifting heavy weights to be best avoided. And I'm talking about heavy weights like moving furniture or carrying bags of shopping, groceries, or luggages to the airport. Okay. Otherwise, generally, you're able to do most of the things yourselves. Now, coming to the risks of surgery. Hopefully, everything should go straightforward as I've explained to you before. but any surgery done wherever in the world by whomever has got some inherent risks involved in it. Whether you're told about the risks or not, they're there, they do exist. Some of the risks are because we're cutting tissues, bleeding, the tissues can bleed. We have various ways to control the bleeding. We have medications, we have stitches, we have machines which use coagulation to stop the bleeding. But over on top of that, some people can actually bleed more heavily and require blood transfusion. We'll give you blood transfusion only if required. The other complication is infection. We give you antibiotics before the surgery, after the surgery. We take extra precautions. Everything is done under aseptic precautions. Despite all this, people can develop infection, sometimes inside the abdomen and sometimes in the skin area. This infection can happen either in the first week or in the maximum 2 weeks' time. If this happens, we can give you more antibiotics and can be sorted out. Injury to the surrounding structures. Your bowel, your bladder, tubes carrying urine from the kidneys to the bladder are all close by. We take extra care not to injure any of these, but sometimes they can get injured. This injury is mostly detected during the time of the surgery, but sometimes can become evident in the first week or the first 10 days of the surgery because of the altered blood supply. If this happens, it can be detected and sorted out. Thromboembolism or clotting in the legs or the lung is a risk for anybody who's having a surgery or admitted in the hospital for a long time, bedridden, even if you have a fracture. Generally, we make an assessment of your high-risk factors for thromboembolism, and if you are high risk, you get a treatment dose of medication which prevents the clot formation. If you do not have any high-risk factors, even then we actually give you TED stockings, which are compression stockings, which helps the blood flow. We give you medications which prophylactically prevent the clot formation, and we also give you enough hydration. The key thing is to actually mobilize and have enough water when you're back home. This prevents the thromboembolism. After any surgery, there are certain warning signs that you need to be looking for. If you have excessive pain, heavy bleeding, foul-smelling discharge, fever, giddiness, feeling unwell, you need to come back to the hospital immediately. Majority of the cases, your surgery will be done by keyhole. However, depending upon the complexity of your case and if there are any problems during the surgery, you might end up having a bigger cut, which is something that cannot be predicted beforehand. If you have your ovaries removed, you might find that you have menopausal symptoms, which can be treated after assessment. To know more about menopause and its symptoms, kindly watch my video titled How to Deal with Menopause. Good luck. Kindly check the information part of this video for a link to my blog, Dr.Usha Kiran, blogspot.com, and the Facebook link. And you can contact me on my WhatsApp number 0091 720 801 2411 for any further queries.